branch blocks. It will include right bundle branch block, left bundle branch block, left anterior and left posterior fascicular block, bifascicular block, and the trifascicular block. I will try to make it very simple, and I'll restrict myself to the findings of the ECG about these bundle branch blocks, not going into the details of these problems and their management. So this video is going to be about the summary of the bundle branch blocks. Summary of bundle branch blocks. So it will be as simple. So in future, anyone can actually, just by looking at the ECG, can know that if there is any finding regarding the bundle branch block. In this diagram, I have actually given the numbers to the bundle branches so that we can actually study their ECG findings in the same order. Like on the number 1 is the right bundle branch, on the second number is the left bundle branch, then third is the left anterior fascicle, and the fourth is the left posterior fascicle. When we will try to study the ECG findings of these branches in the same order. For example, in case of the right bundle branch block, in right bundle branch block, first there should be a QRS complex broader than 0.12 second or broader than 3 small boxes. This is the first condition of the right bundle branch block. And second is there should be an RSR pattern in a lead V1. This is R, this is S, this is R prime. We also call it rabbit ear pattern. Rabbit ear pattern. So when the QRS complex is broader than 3 small boxes and there is R, S, R prime pattern in lead V1 or V2, and probably it's in the lead V1. It's also known as rabbit ear pattern. Then this will be known as right bundle branch block. But sometimes you do find a broadening of the QRS complex, but you do not find a typical RSR pattern or the rabbit ear pattern. In that case, you should watch lead V1. You should look at the lead V1. If there is a broad QRS complex and there is a tall R wave in lead V1, tall R wave in lead V1 and QRS is broad, even then it would be right bundle branch block. A broad QRS complex and a tall R wave in lead V1 will qualify for the right bundle branch block. Now comes the left bundle branch block. In case of the left bundle branch block, on the second number it is the left bundle branch block. Left bundle branch block. If the block is here, this left main branch is blocked, then the changes will be, firstly there will be a broad QRS complex. Broad QRS complex. QRS will be more than 0.12 second in duration or more than 3 small boxes. More than 3 small boxes in duration. Secondly, there will be M pattern. M pattern in V5 or V6. V5 or V6 will be something like this. V5 or V6. So, whenever you look at the ECG and there is broadening of the QRS complex, the QRS complex is more than 3 small boxes or more than 0.12 second, and there is M pattern or 2 notches, R and R prime. There are 2 notches in the lead V5 or V6. This will be known as left bundle branch block. Again, there can be a scenario where you find the broadening of the QRS complex, but you do not find a typical M pattern in lead V5 or V6. Then again, you should look at the V1. If instead of a tall R wave, there is a deep S wave and a very small R wave and a broad QRS complex of the lead V1, it means it is again left bundle branch block. So in some instances there is a broad QRS complexes on the ECG, but there is no typical M pattern or notched R waves in the V5 or V6. In that case, you will again look at the V1. If there is a broad QRS complex and there is a very small R and a deep S wave in the lead V1, so this is again left bundle branch block. Now let's see what's the definition of the what is the ECG definition of the left anterior fascicular block. On the number 3 is the left anterior fascicular block, and in the past it was used to be known as left anterior hemi block. There will be left axis deviation, lead 1 positive and lead AVF negative. This will be the first condition of the left anterior fascicular block, that there will be left axis deviation. This is left axis deviation. Secondly, there will be in lead 1 and AVL a small Q and a tall R wave. 1 and AVL, which are the lateral leads, a small Q and a tall R wave. This is lateral lead or 1 AVL. So small Q and tall R on 1 AVL. And the third condition is there will be a small R and deep S wave in lead 2, lead 3 and lead AVF. A small R and a deep S. And lastly, the QRS will be narrow QRS complex. QRS complex will be less than 0.12 second. So this will be left anterior fascicular block. How you see the left anterior fascicular block on the ECG? There will be left axis deviation. One will be upward and AVF will be downward, and even the lead 2 should be downward, because left axis deviation should be around like -45 or more. Secondly, the lateral leads of 1 and AVL will have a small Q and a large R wave QR pattern, and the inferior leads, which are 2, 3 and AVF, they should have a small R and a deep S pattern. Fourthly, the QRS complex should be narrower. It should be less than 0.12 second. Now let's see what will be the finding in the left posterior fascicular block. The fourth one is the left posterior fascicular block. So fourth one is left posterior fascicular block. In the past it was used to be known as left posterior hemi block. What are its characteristics in the ECG? Number 1, there will be a right axis deviation. How? Lead 1 will be a negative lead and lead AVF will be a positive lead. So this is going to be a right axis deviation. Secondly, lead 1 and AVL will have a small R and a deep S wave. Both lead 1 and AVR, which are lateral leads, they will have a small R and deep S pattern. Thirdly, there will be a small Q tall R wave pattern in lead 2, in lead 3 and lead AVF. A small Q and a tall R. Small Q and a tall R in lead 2, 3 and AVF, which are inferior leads. And lastly, again, the QRS will be narrower. It will be less than 0.12 seconds. So if you look at the ECG, and you find that there is a right axis deviation, there is a small r deep S pattern in lead 1 and AVL, and there is a small q and tall R wave pattern in lead 2, 3 and AVF, and QRS is narrower than 0.12 second, and there is no other cause of the right axis deviation like the pulmonary embolism, tricyclic drug overdosage, or right ventricular hypertrophy, then you can safely say that this is a left posterior fascicular block. Then there is bifascicular block. Now we are done with these blocks. Here comes the bifascicular block. Bifascicular block. What is bifascicular block? Bifascicular block. Bifascicular block is when there is a right bundle branch block, right bundle branch block, plus either left anterior fascicular block or left posterior fascicular block. This is what we call bifascicular block. So what is the definition of the bifascicular block? Bifascicular block is when you have a right bundle branch block plus either left anterior fascicular block or left posterior fascicular block. And what is trifascicular block? Trifascicular block. Trifascicular block. Trifascicular block is actually a bifascicular block, plus either first degree AV block or second degree AV block or a third degree AV block. Third degree AV block. So what is the trifascicular block? Trifascicular block is actually bifascicular block plus either first degree AV block along with the bifascicular block, or bifascicular block plus second degree AV block, or the bifascicular block plus the third degree AV block. Just keep one thing in mind. These branches, these are living things. They have got a blood supply. They are prone to degeneration. They are prone to be affected by different electrolyte disturbance in the body. For example, if there is some problem with the right coronary artery, it might affect right bundle branch. If there is a problem with the left anterior descending artery, it may affect left bundle branch or the left anterior fascicle. If there is a problem with the left circumflex artery, it may affect left posterior fascicular block. If there is degenerative diseases, if there is any myopathies in the heart. So having an idea about the bundle branches and their blocks helps a doctor to understand the cardiac problems which are associated with all of these problems. So in the last 4 videos, I have tried to cover all these bundle branches and their associated fascicular blocks and try to give a little bit idea. These videos are basically for those doctors who are actually trying to understand the basic concepts of these things. There are so many books, there are so many nitty-gritties, there are so many minor things which I didn't bring it up because these videos are not meant to make the doctors expert in these things. These are meant to just give a little bit of idea, a little bit understanding of these things. So whenever there are certain videos which require the details of these things, I'll be able to explain everything in detail, but in these videos I just try to give a little bit of idea so that any doctor can understand what are the branches, how their blocks are picked up from the ECG, what's their management, initial management. Otherwise these are very lengthy topics, but I hope this summary gives some idea of it.